So to provide some background information, I'm the director of one of Drew's New York semesters. We focus on the social entrepreneurship sector. And so the main thing that we ask ourselves during this semester is what kinds of economic decisions face nonprofits and how do they think about revenue streams and costs. And at the same time, we also spend some time looking at the rise of corporate social responsibility and the juggling of the triple bottom line, profit, people, and planet. So the way I'm going to approach this presentation is to really ask the question, how do governments and also IGOs, which are intergovernmental organizations such as the UN, nonprofits and businesses collaborate to address social problems? And as you can see, there's a triangulation that you can think about and that relationship between the three sectors. So in terms of methodology, I'm mainly going to focus on obviously the academic literature that we have been looking at as a class. But also this has been an experiential program. So before the coronavirus hit us, we were actually physically visiting lots of locations, and we had field trips and meetings with a bunch of very, very wonderful community partners who hosted us and told us about their experiences running nonprofits. And this has continued since the virus hit. We've just gone to Zoom sessions. So many thanks to the many Drew alums in particular, but also others who've been willing to host myself and the students and have shared their valuable knowledge and experience with us. So just quickly an overview, the nonprofit sector is a pretty big contributor to the economy. About 1.56 million registered nonprofits in the US alone, and that's just one country. The revenue generated was about 985 billion in 2015, which is about 5 or 6% of the GDP. And private giving by individuals, foundations, and businesses totaled about 410 billion. So that's a pretty big chunk of the economy. More importantly, I think for our purposes is 1 in 10 jobs is in the nonprofit sector. So it's a fairly big employer. And in New York City, that number is even higher. About 15% of jobs are in nonprofits, about 12.3 million employees. And over the decade, nonprofit jobs have grown 4 times faster than for-profits. So you also have high levels of volunteerism. About 25% of US adults volunteered in 2017. And if you estimate the 8.8 billion hours that are donated, that's almost $200 billion in terms of in-kind contributions. So thinking about this sector, we can think about what makes up this sector. Healthcare is the biggest, and obviously is going to be one of the things we focus on given the crisis. It's about 55% of employment. Education's quite big, social services, but you also have arts and culture, religious organizations, international development organizations, advocacy, member-serving organizations such as unions and business leagues, and also, very importantly, foundations, which are quite different than other types of organizations because they give away money rather than asking for money. So what are some of the challenges that this sector faces in the current context that are common to all of them? One is that they're very worried about future funding streams. Not surprisingly, people are worried about what is the future of donations, what is the future of volunteering. There's also very, very urgent problems in terms of immediate cash flow, like how can people pay the bills because of what's happening in terms of a decline in revenue generation? They're facing challenges in terms of how to pay their bills. Many nonprofits are also having to make very difficult decisions concerning employment and service provision. Should they furlough their employees? Should they keep them? Can they keep providing the services that they have provided? There's also lots of challenges in terms of maintaining services and adjusting the mode of delivery, and I will talk more about that in a minute. They are troubleshooting challenges that they have frankly never faced before. This is like a new era for nonprofits, and there's a lot of uncertainty about the future. So I'm going to go into some of the details on this. But before that, I also want to talk about how many differences there are in the sector. For example, not the types of revenue streams that nonprofits receive vary considerably. And these may be grants that they get from governments or from foundations. They may be fees for services, ticket sales, individual donations. And so that really varies depending on the part of the sector. And so the income streams that these organizations have access to now really varies as well. There's also quite a bit of variation in terms of how they employ labor. Do they use a lot of volunteer workers? Do they mostly have a paid labor force? What is the balance between what we call white, pink, and blue collar employees? What types of services do they provide? As you're going to see, they're quite different. And do they have the ability to shift to online operations? To what degree are they determined to be essential? And that's going to be an important question to ask. Obviously, the portion of the sector that's the most on people's mind is the healthcare sector. One thing that's important to note is that the healthcare sector is made up of for-profits, nonprofits, and public facilities. So it's already demonstrates that triangulation between the three parts of society. Obviously, there's been a huge increase in demand for certain services, particularly, and these are many face-to-face services, so they're not necessarily things that can be delivered online. Healthcare workers are facing incredible risks in terms of their labor conditions. We've seen lots of information about the severe shortage of inputs that are needed, particularly for treating corona. There's questions about how to finance what are very expensive treatments and long hospital stays for some people. There have been ethical questions raised about how and whom to provide care to in light of shortages. There's also immediate and urgent research and development needs. So I think, and that one thing that's really come out for me in all of this is that that triangle between government, the private sector, and the nonprofit sector has really been shown to be an important thing to think about. Like, the government is the ones that can really more easily acquire some of these inputs, and they can really push for some of these. And then, but the nonprofit sector is one of the biggest service providers. So if you hear Cuomo's updates, he's talking daily to hospitals about how things are going. And right, that triangulation between the corporate sector, which is providing some of the inputs, the nonprofit sector, which is providing the services, and the government has really been brought into very stark sort of focus. Education, obviously, I'm in an education facility, and two of my other Drew colleagues have already focused on this topic, so I won't spend a lot of time on this, but there have definitely been real challenges in terms of direct service. Like, we've sort of assumed that we can be in a classroom with a group of students, and suddenly that's no longer the case because of social distancing. So there's been a lot of adjustments in terms of the type of services that we can deliver. There's been changes in expectations of workers, and there's been, on the other side, there's been a lot of concerns about loss of endowment, right? You've got a big endowment, and suddenly that endowment has been cut because of the changes in the stock market, and I'm going to talk about that in more depth a little bit later. How to deal with a difficult teaching environment and the stress that our students are going through and still deliver content, still think about grades. And I think even more importantly, there's a lot of long-term anxiety about how the economic conditions are going to change students' financial situation. Will they be able to continue with their education? Many schools in the United States rely on international students for a portion of their tuition fees. And so will travel restrictions continue? Like, lots of questions about not just delivering education now, but also what are the long-term financial implications of this. I think it's also important to note that universities have played a key role in linking the healthcare sector with research. So some universities have ended up on the forefront. Johns Hopkins is a good example because they've really been following the data, and they're also doing a lot of healthcare research. So again, you can think about triangulation even within the nonprofit sector as well. This, obviously, the social service sector is the one that we probably think about the most because they are the sector that are really responding to the crisis, and particularly the economic crisis. They don't get a lot of money by charging fees because most of their services are provided to people who are unable to pay. And the social service sector is seeing a huge increase in demand. Unemployment is creating considerable economic hardship. So for example, the demand for food services has gone way up. Mental health challenges and anxiety about the future There's a lot of concern about vulnerable and underserved populations, how to service, how to make sure that undocumented workers, for example, who are not eligible for federal aid, or the homeless population that was already very marginalized, how to help them. And just to give you some examples from conversations we've had with our nonprofit partners. So if you are a food bank, I mean, if you're providing food and shelter to low-income people, you're worried about your availability of inputs. Just to provide one example, the restaurants are all shut. And historically, restaurants have often donated excess food to shelters and to food banks. And now that source of food is no longer available. If you're running a shelter and you're worried about social distancing, how are you going to make sure that you're meeting the needs of the people who need shelter, but also protecting their health? There's lots of issues around labor as well. There's been a huge drop-off in volunteer labor. A lot of labor has historically been provided by corporations who ask their workers to go and volunteer for a day. And obviously corporations have asked all their workers to stay home. So there's been a big drop in volunteer labor. There's a lot of strain on the paid employees. They're really stressed out about the fact that they can't deliver the services they used to. Another example that we heard about is people who help the elderly, who are often very vulnerable and are physically isolated. And so there have been all these ways to bring them into senior citizens centers, and now those have closed. So the elderly who are already somewhat isolated are even more isolated. That puts stress on the elderly as well as the employees who used to serve them. Obviously, there's a lot of concern about long-term financial support. Will the social service sector have the money it needs to continue to provide the services that are so direly needed? And just to give you another example of the sort of triangulation between the subsectors, one of the people we interviewed mentioned to us that if you think about the homeless population, where do they go to wash their hands and to clean themselves up? They usually go into places like museums, libraries, and other public, sort of semi-public bathrooms. And all of those are now shut down as a result of the social isolation. So there's all these sort of small changes. I mean, the changes of social isolation, we think about them when we're sitting at home, but they're much more impactful on populations that are homeless. The arts and culture sector obviously is very different from the social service sector. Most of the arts and culture sector actually makes their money by selling tickets, and they rely on visitors. You have to walk through the door of the Met Museum or the Met Opera in order for revenue to be generated. So these organizations have all had to shutter their doors. They're not allowing visitors. And so they've had a huge drop in their revenue because they're not allowed to allow visitors. And they face a huge labor cost challenge. They've had to shut their doors. And the question is, do they pay their employees if they're generating no revenues? So there were two big articles in the New York Times about this. The Met Museum has decided to continue to pay their workers for the time being. The Met Opera has decided to furlough. So you see two very large institutions in New York City that have made very different decisions about whether to furlough their workers. Now, again, the Met Museum's been able to do this in the short run, but obviously there's cash flow issues if you think about longer term. Endowment, a lot of arts and culture institutions also rely on endowments for a lot of their income generation. So that's been another concern as their endowments have dropped. And smaller arts organizations are obviously facing much bigger challenges. I mean, I point to the Met Museum and the Met Opera that are, because they make it into the New York Times, but if you think about smaller arts organizations, they are facing a much bigger struggle because for them to have their doors closed for a month or two, or maybe even more, is going to be a huge hit in terms of their revenue generation. There's also huge questions about the future of social distancing. Even if we are able to open up, is the Met Opera going to have to keep every other seat empty, for example, because we need to maintain social distancing? Should museums only allow in 10% of the visitors that they did in the past? So there's a lot of questions, not just about right now and how to deal with their loss of revenues, but there's also questions about what is the role of arts and cultures in the near future in light of the crisis. Also, how are donors going to view arts and culture in a context where there's so many immediate sort of life and death types of needs right now. Another part of the subsector is religious institutions. And this one's a little more tricky because many of the organizations I already talked about are also religious. There are lots of healthcare facilities, for example, are run by the Catholic Church. Education, many universities have some kind of affiliation with a religious group. Social service organizations are often religiously based, and international development and advocacy entities may also be religious based. But what I'm talking about here is the category of houses of worship. Right now, all houses of worship, mosques, synagogues, churches, they're all shut down. So how can the spiritual needs of communities be addressed in the context of isolation? Churches, mosques, and synagogues provide a place for gathering and for social exchange, and those are now shut down. In addition, what are the material needs of faith communities? Religious institutions have often prioritized the needs of their faith community, and they're obviously struggling because they see that their faith communities are in need, and they have to figure out ways to address those challenges. I'm not going to spend a lot of time on the international development focus, although this is one of my areas of expertise. And that's mainly because many of the partners that we've been talking to are not in the global south. But I am going to use a little prop here. You know, this is a global pandemic. It is affecting the whole world. And the poorest countries are going to have the hardest time coping with this pandemic. They have worse infrastructure, they're more economically vulnerable. And unfortunately, the gap between the rich and the poor, which is already fairly large, is likely to grow. And so I think one of the really urgent questions that needs to be asked is the global north going to be willing to continue providing funds to less developed countries? And I think some other questions that can be asked are, what is the role of global interconnectedness, right? Like, we're seeing that on the one hand, Corona was basically started because of globalization, but it's also key that we address this as a global community. So nonprofits that are global in nature are going to play a very important role in addressing the pandemic, both in the short run and in the long run. And again, though, the question is, are they going to be able to get the funding that they need in light of the fact that there's a lot of pressure to focus on problems closer at home? And so this is a real open question, how we're going to deal with global inequality in a context of the pandemic. Another group, which is very different than the other organizations that I've talked about, is foundations. They are also nonprofits, but they are very different because whereas all the other nonprofits I've been talking about basically request funding so they can provide services, foundations are in the business of giving out money. And let's see if I can get this link to work. So I'm not going to spend a lot of time on this, but you can see that, you know, obviously some of the most famous, Bill and Melinda Gates, J. Paul Getty, Ford Foundation, lots of nonprofits, lots of foundations giving out large sums of money in the billions of dollars. So these are really important players in all of this because they are at the center of what's happening in terms of funding. How is the screen back to the full size again?
Yep, looks good.
Okay. So one really burning question, obviously, is how have the endowments of these large foundations been affected by the changes in the stock market? And then how will the stock market changes affect their ability to provide funds? And how will their priorities change in light of this crisis? And I think one of the biggest questions that needs to be asked is, should foundations be only spending the legal minimum that they're supposed to spend, or should they be reaching way deeper into their pockets and really spending much larger amounts? Because remember, they're only required by law to spend a very, very small portion. They basically have to spend most of the income from their endowment, but they don't have to dip into their actual wealth. So a number of foundations have already changed their approach. So that is the good news. Like foundations are thinking very actively about what their role can be, but they're also challenged in this moment because the question is, what should their contribution be? Another segment of the nonprofit sector that is often overlooked, but is hugely important, is the role that advocacy nonprofits play. So advocacy nonprofits are the ones who, on the one hand, are advocating for other nonprofits. So they're like membership organizations. So Nonprofit New York, for example, is a nonprofit that represents lots of other nonprofits, and they play a role of actually advocating and making sure that the nonprofit sector is seen. And one of the shocking things about the federal response was that the nonprofit sector was largely overlooked in the initial federal response, which, if you think about the slides I just presented, if the healthcare sector is not largely a nonprofit sector, if other segments of the nonprofit world are in dire economic need and they employ 10 to 15% of the labor market, why were they overlooked? I think definitely this crisis is going to lead to a realization that health policies need to change, and advocacy organizations are going to be on the forefront of pushing for changes in policy. But the other question that's sort of worrisome is, are other forms of advocacy going to take a back seat? Is discussions about human rights, discussions about civil liberties, discussions about the environment going to take a back seat in a context where we're so focused on healthcare? The other important role that advocacy organizations play is that they are the watchdogs over corporations and government. And I'll provide some examples of that. I've already mentioned the focus on shifting away from non-essential services. You know, are funders gonna focus more on healthcare because that's the crisis, or are we gonna think about essential services in other ways? And that's a really important question. So just to give you an example of how this works, about a week or two ago, Drew has two New York semesters running right now. We have a Wall Street semester and we have a social entrepreneurship semester running. And we brought the two groups together to have a conversation about what was the impact on Wall Street and what was the impact on social entrepreneurship. Of course, to separate these two is a bit of a fallacy because Wall Street and social entrepreneurship are very, very, very intimately linked. So the stock market's relevance to nonprofits can be seen in three different ways. One, endowments, we mentioned already. Endowments are a big source of income for many nonprofits, and they're also a rainy day fund. So if your endowment has gone down, you're in a crisis because you've lost money on the stock market. Secondly, many, many nonprofits rely on donors, and donors have their money in the stock market. So if foundations, corporate donors are feeling a big economic hit, how's that going to impact the funds that they're going to be willing to give to nonprofits, both in the short and in the long term? But finally, nonprofits are the watchdog over the for-profit and the government sector. And just to give you one example, ProPublica, here's a highlight of some of the ways that this watchdog role is super important, right? In light of, and this was just one senator, it was one of the early cases, but we now have evidence that a number of our government elected officials were possibly using insider information. And so the question is, if nonprofits are not on the job and making sure that monitoring this kind of behavior, that's going to create challenges. So the watchdog role of nonprofits is super important. And in my students' class, we've studied a theory by a person named Adil Najam about the 4 C's. Nonprofits are supposed to cooperate with government. They're supposed to complement government. They can sometimes be co-opted by government, which is the case where the nonprofit basically does the government's bidding. But I would say that one of the most important roles of nonprofits is confrontation. I'd say right now, the two most important roles are cooperation and confrontation, right? On the one hand, nonprofits have to be delivering services. They have to be really, really, really helping out the government in this really crucial moment, and they are. But they also have to be in that confrontation mode where they are playing a watchdog role. And for those of you who are interested in this, there's the Institute for Nonprofit News Indicators that actually looks at the question of media, nonprofit media, and their role in serving as a watchdog. So that's a useful link for people. And you see that I put in a few statistics there on the role of the media. So in conclusion, the nonprofit sector is vital to addressing social problems. There's no doubt about this. The nonprofit sector has definitely risen to the challenge. They have really, really worked hard to address the many, many social problems that are arising. They're a key partner of both government and the business sector. And yet, they're a sector that was largely forgotten during the initial federal response. Different segments of the sector are facing very different challenges. And so it's really hard to talk about a one-size-fits-all solution to the nonprofit dilemma, because the types of services they provide, the degree to which they can go online versus have face-to-face interactions, their funding streams are all up in the air right now. And I would say that in the short run, nonprofits have really risen to the challenge. They've adjusted a lot and responded. The long-term challenges are more unclear. What is the future of social distancing in terms of the ability to deliver services? In the education sector, we're asking ourselves this question, but this question can be asked in museum context, in healthcare context, in education context, in arts and culture, right? Like if we are gonna have social distancing as sort of the norm, how are nonprofits gonna continue to deliver services? Questions about how society will redefine essential services. Do we really just focus on the healthcare sector, or do we argue that arts and culture are key to the human spirit, and therefore they have to be supported just like healthcare has to be supported? Will smaller, less funded nonprofits even survive this economic downturn? The big nonprofits are going to make it. There's no doubt about it. They have deep endowments. They are really on solid grounds, but smaller, less well-funded nonprofits, just like businesses that are under threat to go out of business and to have to shutter their doors forever, smaller nonprofits are in the same boat because they are facing severe revenue shortages, and yet their cost structure, they still have to pay the rent. They're hopefully still trying to pay their employees. And as I mentioned before, the need for the watchdog confrontation aspect to be strengthened, sorry. And that's a particular challenge because who wants to fund watchdogs, right? Corporate sector doesn't want to fund watchdogs, and the government doesn't necessarily want to fund watchdogs because their role is to oversee the government and the corporate sector. And so that group is definitely one of the more challenged, and yet one of the key components of us getting out of this crisis in a way that we move forward and have positive social change. That is the end of my formal presentation, so I can take some questions.
All right, thank you, Professor. We do have a few here, and I'll be continuing to monitor the chat if anyone wants to submit others. So I'll start off here with what is your view on the strategy that the current administration and government have put forward when it comes to the nonprofits?
So that's a tricky question. If you think about government, there's three levels of government. There's the federal government, there's the state government, and then there's local government. So I don't think we can talk about a single strategy. I would say that all segments of government are a little bit guilty of forgetting the nonprofit sector in the short run. And that is very frustrating and a bit shocking to me, given that I've been studying this sector, and it seems really obvious to me that the nonprofit sector is a really important part of our economy and a particularly important part of the response to this crisis. So I would say that the government in general has not done a very good job of recognizing the needs of nonprofits in the short run. But let me tell you, the advocacy groups are working hard to change that. And I think governments are coming around and identifying, oh, wow, we forgot about the nonprofit sector. So that is shifting now. So I would say that it's a work in progress, and the governments have recognized, both at the federal, the state, and the city level, they are starting to recognize how important this sector is, and they're starting to shift in terms of the kinds of aid that they're providing.
Gotcha. Okay, another question here. What do you think the best thing that places of worship can do to address the needs of their communities?
That's a really good question. You know, that's so varied. And I would say that one of the things to do is just to reach out to the places of worship that you are participating in and find out what their needs are. I know in Harlem, we have issues with individuals who are very isolated. They need people bringing food to them, right? Like religious institutions are on the forefront of all kinds of service provision, just like non-religious secular institutions. So the number of things that can be done, from, you know, maybe chatting with a senior citizen who feels lonely, or helping to deliver food, there's quite a bit. And I would say that you should reach out to your local religious institution to see what their biggest needs are. And I would also say that remembering that whether you prefer to give to religious institutions or non-religious institutions right now, obviously one of the important things is to, if you have the money to donate, because cash is definitely a really important component that's going to help them to do the kinds of services that they've been doing historically.
And I think that actually ties into a possible answer for, there's actually two questions that basically are touching the same thing. So I'll read both of them. One is that it makes sense that the healthcare industry is taking the spotlight now, but how can we avoid things like the environment, arts and culture, human rights, etc., coming back into the fold as time passes? And then the other one that is in the same vein, how can we make sure that smaller nonprofits are able to stay open? Is it simply donating to them, even when healthcare nonprofits might feel more timely to contribute to?
Yeah, those are really good questions. And I would say I've really changed my giving habits since I've started teaching this nonprofit program. I used to give to really big nonprofits, and I still give some money to big nonprofits. I think, you know, Doctors Without Borders, for example, is an organization that is on the global front, really on the front lines of treating healthcare. So certainly those are still important, but I do think, like, rethinking and thinking about, are there small nonprofits that you really care about? And are they more in need right now? And you can go onto that webpage that, you know, there are ways to find out what an endowment of an organization is, and do they have pretty deep pockets, or are they really on a shoestring budget? And so you're going to be able to help them to get through it. This is a tricky question. And I would say you have to take into account your personal preferences. I do think that lobbying, you know, the sector is lobbying as a whole, because obviously you as an individual can give, but this also has to be a response that we do as a nation and as a globe as well. It can't just be individuals giving money. And so definitely advocacy organizations are continuing to push and to really ask that other segments of the nonprofit sector do not get shortchanged. Some of the aid that is going to the nonprofit sector is targeted to smaller nonprofits. And there's a recognition among the large nonprofits that, hey, we have deeper pockets, so we shouldn't be at the forefront of asking, and we should step back and allow smaller nonprofits. I think collaboration among nonprofits is also going to be key. You know, there are organizations, so example, all the museums in New York City, they actually work together and they collaborate quite a bit. So they're competing with each other, but they're also collaborating. And I would say that part of the answer to this is that there's going to have to be a more concerted effort on the part of arts and culture organizations to think collaboratively about how can we survive as a group rather than, you know, pitting each other against each other. The foundations have already started thinking about this too. And I know some foundations have said, we are not going to lose sight of our mission. For example, the Dodge Foundation, they fund poetry. They are not going to stop funding poetry. Like, they really believe that culture is part of the soul. And so they're going to continue. So I would say individual foundations that already saw this as a priority for their mission are going to continue to do it. I do think individual donations are an important component of this, but also thinking about listening to what your elected officials are saying. Are they forgetting about the nonprofit sector? So getting involved in advocacy campaigns, I think, is also a key role, right? Like, I think it's also important to think about the fact that these are not separate questions. We're finding out that the environmental damage that's being done because we shut down the economy is a lot lower. So this may be absolutely the moment to bring environmental concerns to the forefront, because we've now have there's also evidence that corona may actually be people may be more susceptible to corona in contexts where there's more pollution. So both of those factors actually tell you that if you focus on healthcare at the cost of all the other parts of the nonprofit sector and all the other social problems, you're actually not taking the right approach. The right approach has to be holistic, and the right approach has to think about healthcare as being integrated into mental health, arts and culture, environment. And so any approach that we take needs to think about how to bring all of those factors in together, I would say, rather than saying, oh, we have to prioritize health. We prioritize health by prioritizing the way health is interconnected with the rest of the sector.
And we have one last one here, unless another one comes in as you're answering this. How do we avoid nonprofits and watchdogs from being subjected by cooptation?
That's a great question. My students and I spend a lot of time on that. And I think that fortunately, the US has a very strong watchdog sector. And certainly in recent times, the watchdog sector has gotten a lot of donations because there's been worry about that watchdog sector coming under attack, but we have to remain vigilant. The watchdog sector really has to rely on either sort of maverick foundations that are a little bit different from mainstream foundations, or they have to rely on individual donations. So I would say that the watchdog sector is an important sector to not forget about, because they want to be they do not want their support to be tied to corporate and government funding, because they want to maintain their independence. So I would say that that part of the sector, the watchdog sector, is actually a part of the sector that requires a lot of attention. And is, again, if you think about that, if you think about the fact that this has to be a holistic approach, if we only focus on healthcare and we don't give money to the watchdog organizations that are monitoring whether healthcare is being delivered properly and whether there's corruption in the healthcare sector, right, we're going to be in trouble. So we cannot have a healthcare sector that stays healthy if the watchdog nonprofits that are monitoring that sector are also not healthy. So I would say that's an important part of donations that you should think about. And also think about ways that you can support them in other fundraising, volunteering. Watchdogs is a great thing to do while you're sitting at home, because you can do a lot of watchdog activities from the privacy of your home, right? It's not about direct service delivery. So maybe think about reaching out and volunteering to a watchdog organization and helping them monitor press releases or other kinds of information that are coming across the internet right now.
Great. I think that's it for questions. So I'll say thank you, Professor, and thanks everyone who tuned in. Be sure to check Drew's website and social media pages for the YouTube recording of this presentation as early as later today.
Thank you for all the great questions. I see some familiar faces, which is very nice, and some new faces as well. Have a great day.
All right, thanks, everybody.